Hello everyone. As you probably have heard, we have had a couple cases of COVID-19 in Whistler schools this week. Vancouver Coastal Health is actively managing the situation. You will be contacted by School District 48 and VCH if there are changes recommended for your family by public health. Some close contacts and classes have been asked to isolate out of abundance of caution and to ensure and prevent the further transmission of the virus. VCH will be following up with cases and contacts by phone until those cases are cleared. Let's take this as a reality check so that we are further motivated to be careful in social settings. The main way this virus transmits is by close contact in inside social settings with people outside our households. There's been a lot of talk, for good reason, about ski lines lately, but those lines are not the primary vector for transmission. The setting that is most dangerous is inside with people that you know. So exercising restraint in those social settings will help us get back to seeing each other again and doing so in a safe way. Canada was just informed that there will be delays in receiving further Pfizer vaccine supply, and that will be delayed until early February. This delay will temporarily slow our delivery and our movement into the next phase of immunization. Dr. Henry was aware that there would be changes and challenges throughout the process, and so BC has focused on being nimble and ready to change and pivot. And they have responded accordingly, so things are working in a good way. It is a setback, but it's only a delay. The vaccine is coming. It will mean the focus of vaccination will be on providing second doses rather than first for a short time. But when the supply ramps back up in the next 2 weeks, BC will return to focusing on first doses again. The focus continues to be on immunizing all people who are high risk, people in acute care, health care, and long-term care, and those working in the health system. The biggest risk we all have is our own behaviors. No matter which variant we have in our community, we will need to continue to keep our COVID guard up. You know the basics: physical distance, clean hands, stay at home when you're sick, and so on. One of the basics is to get tested even when you have mild symptoms. For me, a lot of this pandemic has sort of blended into itself, but I think it's good to sort of recognize the big advancements that we've had. I mean, the vaccine's the most obvious, but if you look back to March, many of us were concerned that we weren't able to get tested unless we were showing acute symptoms. That's no longer the case. You can now get tested even with mild symptoms. So do that. If you're not feeling well, go in and get a test. Thanks for your time today. Take care of yourself and take care of each other.